months in the. However, from then on, as they mature to the next stage, they begin to die, and only 2 to 4 million primary immature eggs remain at birth. Can you see my screen? Can you see the slide?
No, we can't see the slide yet. Not
To the
yet, but we are
WhatsApp.
about we are seeing your screen, but not the slide.
Yeah, sorry. Let me also on the slide isn't of much importance, but I will on it anyway. Just
Sir, you can share the slide with me. You can share the slide with me.
We're sharing it now. It's on. Have a look. Is it coming?
Okay.
Okay, perfect.
Yes,
perfect. So I will refer to any of the slides when it is required, but I would like to focus first of all on exactly explaining what the menopause is all about, where it all starts and where it ends. So I was talking about these eggs which begin to be formed when the baby girl is in her mother's womb, and there are something like about 7 million or so eggs. By the time she's about to be born, they're reduced to about 2 to 4 million. And by the time she begins to have her periods, she's probably had total of about 100 to 400,000 eggs. They're called follicles at that stage. And each of these follicles is a hollow ball of cells with an immature egg at the center of it. So that's when a girl is beginning to be mature and reach the stage when she begins to have her periods. Now, each of these follicles, the eggs, ultimately matures into an ovum. That is what is called an egg. And at the time of ovulation, that is during the mid-cycle, this egg is released. It joins with a sperm and begins a new life at fertilization. This new human being is then nurtured in the womb. Each menstrual cycle is a race because at its beginning, several follicles begin to mature, but usually only one makes it to ovulation. The ovaries are glands, small glands the size of an almond, very tiny, just the 1/3 the size of your finger. And they are very important part of the female reproductive system. They are placed on either side of the fallopian tube. So you have the uterus, you have the two fallopian tubes, and the ovaries are kept on either side of it. Every month during ovulation, either the right or the left ovary produces one single mature egg for fertilization. Now, on the first day of menstrual flow, the brain receives the signal to begin another cycle. That means basically the brain is informing the uterus that, okay, fertilization has not taken place. All the preparations that were made need not be there. So it sends its own signal to the ovary, and the follicles in that race begin to, the ovaries now begin to produce estrogen. This hormone goes to the lining of the womb, which begins to lay the building blocks to house the expected new guest. The battle belongs to the strong, and thus one follicle produces much more estrogen than the rest, leading to the death of the others. The dominant follicle, that's just one single follicle, when close to ovulation, begins to produce another hormone, and that hormone is called progesterone. So we will remember there are two important hormones here. You have the estrogen, and then you have the progesterone. Progesterone goes to the womb and acts like the cement between the laid down blocks, making it strong. When the follicle reaches full maturation, its ovum is released during ovulation. This egg now travels down the fallopian tube, hoping to be fertilized. Meanwhile, the remnant of the follicles becomes filled with fat and is called a corpus luteum. I know this is a medical word, but just remember the word corpus luteum because it continues to make progesterone to maintain the lining of the womb so that it can sustain that pregnancy for the child to grow. However, if fertilization does not occur, then both the corpus luteum and the egg disintegrate. Now things have fallen apart, the center cannot hold, and the lining of the womb breaks down and flows out through the opening of the womb and vagina as blood. That's the menstrual cycle. So basically, what I was trying to explain here is what happens every month and why it happens. So the cycle basically is an event controlled by hormones, predominantly estrogen and progesterone, in anticipation that fertilization will take place. Therefore, the lining of the womb will be prepared for the new guest to be hosted there, to be fed and nurtured there through the 9 months until the baby is born. But since pregnancy doesn't take place every month, the preparation is there every month. So at the end of the month, when nothing happens, then the signal from the brain is okay, let go. This house is not needed anymore. Prepare another one for next month. So the house in the womb is always ready for a new baby to begin to be formed. So this is it. Now, if we go back when a girl is growing up, you can move the slides 1 or 2 slides forward, go to the third slide. The blossoming or maturity of female characteristics and attributes usually lasts around 30 years, after which menopause or the cessation of menstruation occurs. There is an organ called the hypothalamus, uh, which also influences another organ. I'm just trying to use non-medical language, another organ up there in the brain called the pituitary gland. And these, in conjunction, they produce hormones which are called follicle stimulating hormones and luteinizing hormone, that is FSH, LH. When you go to the hospital, many times, women will hear doctors doing their hormone analysis, and the hormone names that are mentioned are estrogen and progesterone, which I mentioned earlier, and what their roles are. Then there are these hormones called the follicle stimulating hormone. The name itself, shows that they stimulate the production of follicles. And then the luteinizing hormone, which maintains the corpus luteum, which act on the ovaries, and they cause the secretion of estrogen and progesterone. Now, these in turn induce changes in the uterus, causing menstruation as well as affecting the other genital organs and the breasts. These changes regulate the aspect and function of a woman's hormonal cycle. Now, remember, as the estrogen production in the ovary progressively disappears, as the woman ages, this 30 years from menarche, which is the first period, to menopause, which is the mark of the end of the last period, you are talking of roughly about 30 years. So during these 30 years, gradually the amount of estrogen continues to reduce. Estrogen is a hormone which is closely connected to femininity. A woman being a woman, there are so many things that estrogen does. So now this estrogen continues to reduce, and until such a time when it has reduced to such a level that the periods stop coming. Now, the lack of estrogen may lead to an involution of the female genital tract because it affects the way the tract is, the regression of the vagina and vulva formations, as well as its dryness and fragility. It can also make intercourse painful and sometimes very difficult. Now, in order to avoid this problem and to preserve their youth, some women resort to taking estrogens. This is an arguable practice. It can also be dangerous sometimes because higher levels of estrogens have side effects. And if a woman needs to take estrogens, this should be done in discussion with her doctor. It's not something which should be taken lightly. Estrogen is not a subject into which we are going to go into details now because we are focusing on menopause. So what we are talking about now is when the level of estrogen becomes very low over a period of 30 years, then at the end of it, the periods stop. Now, the menopause occurs earlier in single women than in widows, and earlier in widows than in women who have a normal, regular sex life. This is based on statistics. The immediate and total stopping of menstruation is only observed in less than 1/4 of, which sometimes leads them to think that they might be pregnant. In general, the menopause appears as abnormal menstrual cycles to begin with, either in their frequency or in their amount. If they are heavy
There
and
is no
irregular,
problem.
this may cause some alarm, and it is advisable to see the doctor
Urine
in order to rule out other
is okay, no
pathological
problem.
causes.
Huh? Okay. You walk? Did you walk? Okay. But you can able
Now,
to
when
walk.
menopause occurs naturally,
Huh?
it
It's
tends
okay,
to
no
take
problem.
place anywhere
Let
between
me
the age
ask
of
them to send you
40
for
and
the scan.
58.
Okay? Yeah. Yes. You have my number?
Hello?
Take my number. Any problem? Any
Uh,
problem you can.
Rahmat, I think there is a background sound coming in this.
Yes, I'm so sorry about that.
Yeah, can you just
Javed,
ask that if someone's mic is on? So if you can off that,
Javed A70,
yeah.
please can you mute your mic?
Why is it difficult for the host to mute us? Mute our participant, please. We are enjoying this seminar.
Okay, we're so
Y-
sorry about that.
Yeah, just to lower the volume so that the sounds don't overlap.
Okay,
So when,
sir.
when when menopause occurs naturally, it tends to take place anywhere between the ages of 40 and 58, with an average age of 51. My experience in the last 40 years, somewhere between 45 and 50. But for some women, it can occur as early as the late 30s or as late as their 60s. When menopause occurs before 35, it is considered as premature menopause. But just as menarche, which is the beginning of the cycle, is genetically predetermined, so is menopause. So it's different in every woman. For many women who enter menopause, their menstrual cycle becomes irregular to begin with and then stops. So it's not an immediate thing. The cycles begin to go wrong. In the beginning, a woman has her cycles coming every 28 days or 24 or 26. And then suddenly she realizes that, oh, my cycle was 3 days late, it was 4 days late. And she starts getting worried, or it becomes very heavy, or it becomes erratic, or you begin to miss some cycles. That's when you know that the process of menopause has begun. It's not that it has happened, but it has begun. But for others, the decreasing levels of estrogen associated with menopause may cause more distressing symptoms, including mood swings. Now, these symptoms. Can you go to the slide on the symptoms? The commonest symptom which I have seen in my practice when menopause begins to set in is mood swings. And the woman will come and tell you herself that, look, doctor, I don't understand. I just get suddenly become very angry over little issues. I become irritable. And these are the little things that she needs to understand. Her husband needs to understand. Children need to understand. The family needs to understand. Because this is not a disease. This is part of her growing up process. The sex drive is decreased. She can suddenly feel very hot, or she can start having chills. She can start having a very fast heartbeat, headaches. There is a dryness in the vagina. Sometimes it can be sore. She can have trouble with sleeping. And then sometimes she goes to the hospital and she talks of aches and pains. And the common mistake that is done is that, if the focus is not on the fact that this is a normal physiological process, an inexperienced medical professional can subject her to a lot of tests, which is not always necessary. And then, you do an X-ray and you find that, okay, the bones are showing low density, and then suddenly she's referred to the orthopedic surgeon. The reason why I'm focusing on this is that I want to keep re-emphasizing that menopause is a normal part of life. It is not a disease. It is not a disease. The patient should understand that, her family should understand that, and the doctor should understand that. So it should be treated as a normal process, just like when a young girl begins to first see her periods, uh, the mother will counsel her, tell her, don't worry about this, this is normal, this is how it's going to be. And so she's reassured. So that counseling at that stage is very important. And the counseling begins with the woman herself, knowing that, yes, there are discomforts, there are irritations, but there's nothing wrong with my body. Everything is normal, and I'm okay. Yeah. Menopause is a gradual process. The events preceding and following menopause amount to a huge change for women, both physically and socially. Physically, this process has 4 stages. This is something that I would like everybody to focus on. The 4 stages: the pre-menopause, in which their periods have just started to get irregular, but they do not yet experience any classic menopausal symptoms such as hot flashes or vaginal dryness. A woman in pre-menopause is usually in her mid to late 40s. Now, if your doctor tells you that you are premenopausal, you might want to ask him or how he or she is using this term, because you need to be careful, like there are diseases, febrile illnesses, which are very common in the tropics, like malaria, typhoid, that will give you a slight fever, headache, body pains, sleeplessness. A lot of these symptoms also overlap with premenopause. So this woman is now heading towards a situation where her periods are becoming irregular. Once in a while, she's feeling feverish. Sometimes she's feeling cold. She finds that sex has become uncomfortable. She's become irritable. She thinks she has some illness. And it is very easy to go in the wrong direction. She goes to the hospital, and inexperienced medical professional says, oh, let me do malaria, typhoid, this. And don't be surprised that the malaria turns out to be positive. And then she begins to get treatment for malaria. What is very important here is to keep in mind not just the woman, her husband, her family, the doctor, what is her age? If she's between 40 and 50, remember, it could be nothing. It could just be the beginning of menopause. Maybe her estrogen levels are going down, her periods are becoming irregular, and she's heading towards that. Then the next phase is the perimenopause. Now, she's in the menopause. This refers to women who are in the thick of menopause. Their cycles may be erratic, and they may begin to experience hot flashes and vaginal dryness. On an average, women are about 47 when they hit the perimenopause stage. The menopause technically refers to the final menstrual period. You will not be able to pinpoint your final period until you have been completely free from periods for 1 year. So if you haven't seen your periods for 1 full year, you know that this is menopause. And then you count back from that time. You count back to the last period you charted, and that date is the date of the beginning of your menopause. 1 full year of not seeing your periods. After more than 1 year of no menstrual periods due to menopause, any vaginal bleeding is considered abnormal. This is what is another very important thing to take note of. Vaginal bleeding in a woman every month is normal. It's part of being a woman, it's part of becoming a mother. It's part of her womanhood. But if a woman has reached menopause, she's not seen her periods for 1 year, and it's been established, okay, she now has menopause, and then she sees vaginal bleeding, that should be taken seriously. Then the doctor should now look at it from a purely medical angle and know where is this bleeding coming from, because there are so many things. This is not the time to talk about it, but vaginal bleeding in a woman who's had menopause should be taken very seriously. Now, we are now going to talk about the post-menopause. This is the last third of a woman's life. The first third is when she begins to see her period. Then you have the childbearing age. She has children. Then she goes into the menopause, and then the period after the menopause. And this can last from anything from 50 to the age of 100 years. In other words, once you have passed menopause, you will be referred to as postmenopausal for the rest of your life. Now, let me just recap a little bit again, going back to symptoms, because identification of menopause is first done by the woman herself, with the knowledge being shared with her husband, her life partner. Grown-up children should understand, relatives should understand, and her doctor should also know. Among the most prominent symptoms, and if you will notice that the topic displayed with on the slide is hot flashes. We just want to talk a little bit about hot flashes, because this is the most frequent symptom of menopause and the events surrounding it. It basically just means that all of a sudden you are sitting down and you begin to feel hot, you start sweating, and then you probably start having chills. So it's a momentary sensation of heat that may be accompanied by a red, flushed face, sweating. The exact cause of hot flushes is not known, but definitely it's something to do with hormonal imbalance. And of course, consequent upon that, changes in your circulation, the blood vessels that are under your skin, on the face. Suddenly there is this up and down of your pulse rate, your heartbeat becomes fast. So you become flushed, your face becomes flushed, you have these hot flashes. So basically, the hot flashes occur when the blood vessels near the skin surface dilate to cool the body. Hot flashes accompanied with sweating can also occur at night. These are called night sweats and may interfere with sleep. The severity and duration of hot flashes varies among women going through menopause. Some women have hot flashes for a very short time. Others may have hot flashes over many years. Generally, the hot flashes will become less and less severe as you proceed until you have the full menopause. Now, it may be a lot of women will pass through menopause not knowing anything at all. Sometimes there are hardly any symptoms, with a little bit of hot flash, sweating, little irritability, and then little irregularity of periods. And then you find out that you become postmenopausal, there are no more periods again. Sometimes the symptoms are very severe. Uh, so it may be impossible to completely avoid hot flashes, but there are certain triggers that may bring them on more frequently or cause them to be more severe. So to prevent hot flashes, we need to avoid these triggers. The first most important trigger is stress. I'm going to talk a little bit about this because not just women, everybody, as you go through life, the level of your stress may increase to some extent because there are responsibilities, children have grown up, people will have financial issues, there may be relationship issues. So if there is stress is likely to trigger the symptoms of hot flashes. Women who are going through stress are likely to have more hot flashes. Caffeine, coffee, alcohol, spicy foods, tight clothing, heat, cigarettes. So all these things can trigger hot flashes, and it is important to note them down between a couple, because your partner in life that has lived through with you, you've had children together, you know everything about each other. This is a very important phase in a woman's life. So it is very important that your partner knows that the less stress you have, the less likely you are going to have hot flashes. You don't want to start taking a lot of coffee. You don't want to start taking alcohol. You want to reduce the spice in your food. You want to make your clothes a little loose, not too tight. You don't want to smoke. And these are things partners can do together. So the important thing here is to know that just as you get married, you spend life together, you have children together, you should also go through the menopause together. There are other things you can do to keep hot flashes at bay. You can stay in a cooler environment, keep your bedroom cool at night, use fans during the day. Uh, Cotton clothings are better than, fabrics that are artificial, that generate heat. And if hot flashes become too bad, if you're feeling uncomfortable, you can try deep breathing. I don't want to go into the details of how deep breathing is done, but there are short deep breathing exercises that can be done over 2-3 minutes uh, that can reduce the symptoms. But usually, when I see women with symptoms related to menopause, I advise them that sometimes just putting off the light in the room, just lying down peacefully off your phone, just breathe in deep, let go, breathe in deep again, let go, just relax. Disconnect for 5 minutes, and you will be surprised. Your body temperature comes down, your heart rate slows down, you begin to feel more relaxed. So again, I'm emphasizing that this is a normal part of life. Menopause is not a disease. Of course, there are recommendations. If you go online, if you talk to people, they will tell you exercise. Exercise is not just good for people with menopause. It's good for everybody, but specifically because you are going through a stressful phase in your life where your hormones are misbehaving, going up and down. So things like walking, swimming, cycling all help. And sometimes you do need treatment. Sometimes you need treatment, and the treatment is not something big. If your body temperature is going up, you're having body pains, the doctor can give you some paracetamol. Once in a while, a woman will need to have good sleep. So short-term sedatives, it's not a recommended treatment. It should not be taken on your own. But yes, depending on your symptoms, if they're bothering you too much, your doctor may want to just give you something to sleep well for 2 3 days. So a little bit support from medication helps. There is no specific treatment of menopause because menopause is not a disease. That's what I want to emphasize. So basically, you're going to take care of symptoms, and the symptoms can be taken care of by yourself, by support from your partner, by support from your family, and by a good discussion on the subject between you, your friends, your doctor, your family, your children. We should be open about this. In many societies, menopause periods are a taboo. People don't want to talk about this, but that is not a good idea because this is a normal physiological process. Just as when we are small kids, we grow up, we learn to walk, we learn to eat, we learn to talk. This is how your cycles are. And remember, your menstrual cycles are the basis of life. Kids are born because a woman has her menstrual cycles. We are all born that way. So why would we avoid this subject that is so fundamental to your mothers, to your sisters, to your wives? There should be that understanding that that particular individual who is suddenly screaming on you that never used to scream on you before is not ill. She is not misbehaving. She's just going through a normal phase of her cycle. And that woman has gone through that cycle from the time you were born or your sibling was born or whatever, whatever the relationship. So this understanding that menopause is a normal event in your life, it comes with certain levels of discomfort, which can be taken care of with support, with counseling, and sometimes with a little bit of medication. And of course, if there are coexisting illnesses, they can make the symptoms worse. So you need to treat those coexisting illnesses. But then I'm going to end this discussion on two very important things. Number one, I've often counseled younger doctors. Almost always, when a woman is in her late 30s and beyond, when you see her with a bit of a fever, headache, body pain, irritability, depression, being uncomfortable, keep menopause in mind. Keep the process of menopause in mind. And I want to give the same advice to family members, children, siblings, colleagues, and especially spouses, partners. Remember, your spouse could be going through menopause, so she needs your support. Thank you.
Thank you so much, sir, for this wonderful speech. We can see from the chat that this has resonated with a lot of people. Now we have some time to address your questions, but before we dive into the Q&A, I want to briefly connect the topic to the larger mission of the Serifat Ajala Menopause Foundation. That's SAMF. Our goal is to take these critical conversations from webinars like this one and turn them into lasting resources and a supportive community. This is the heart of what we actually do. We host events just like this one to educate and support women's health and wellness. We cooperate with change makers, brilliant experts like Dr. Hassan, as well as doctors, doulas, and advocates to bring trusted information. And most excitedly, we publish Viva Menopause magazine to share stories and expert insights on health, nutrition, yes, and purpose long after today's webinar. Speaking of which, we have a very, very special announcement regarding the magazine. But before then, let's get to the question. So as promised, like Rahama mentioned, we will be taking 3 oral questions to ensure we respect everyone's time. So let's go to the questions part. I'm trying to go through. Okay, the first question is, does all the symptoms of menopause go away after the first year without menstruation? That's the first question that Esther Wazir asked us.
Yes, once the menopause is established and a woman has not had periods for about a year, not only will all the symptoms disappear, but you start a very beautiful phase of life, because a lot of the inconvenience of the monthly periods is gone. You're not looking forward to being pregnant again. And so that is why I always tell women that menopause is not the end of your life, it is the beginning of a new life. So yes, of course, sometimes if estrogen levels become too low, some women would suffer from osteoporosis, which is low density in the bones, so they can have bone pains. But these are exceptions. Normally, like I said earlier on, menopause is a normal process. When it's over, it is over. And if you look at it that way, you can begin to enjoy your life in a different way. Each phase of life as we grow older has its own beauty and pleasure. So you can make the best of that. And a lot of women do that. But yes, it is possible that because of the hormonal changes, and of course, as we age, our bodies are not strong as before. So there are other things that come in. So it is possible to have some symptoms which may be a spillover from the effects of the menopause, but this is rare. These are exceptions. These are not the rules. And so while looking at all other options that are related to your age of 50, 60, menopause should also be considered. But going back again, yes, once the menopause is over, it's all over. You don't have any more symptoms.
All right, thank you, sir. That was insightful. Okay, I missed the first question. The first question goes, is it true that smoke comes out through the head during hot flashes?
No, no, no. Really, what happens is, when you have a hot flash, it's like the temperature within your body going up. So you have this feeling of heat being emitted. That's why it's called a hot flash, like the flash of a fire. You get this sudden feeling, you're sitting normally, and all of a sudden, as if heat is being emitted from within. Hot flash, no, there is no smoke, there is nothing. It's just a rise in body temperature, which happens all of a sudden. It's brought down very easily if you just go to your room, put your light off, lie down for 10-15 minutes, take nice deep breaths, take your phone out, just 10-15 minutes, the temperatures begin to go down. It's always better to solve these things naturally. If it becomes a problem, it's not going away, you can take 2 tablets of paracetamol. If it's still not going away, you can talk to your doctor. Very rarely in some women the estrogen levels go so low that they do require treatment, but this should be under supervision. But no, there is no smoke.
All right, thank you, sir. So the second person asked a question is Imran. He said, thank you, doctor, for this insightful talk. My question is, could menopause be interrogated as an adaptive neuroendocrine, sorry, I am no health professional. So as an adaptive neuroendocrine recalibration whose evolutionary purpose remains under-theorized in contemporary biomedical discourse. I don't know if I'm clear.
Yeah. Yeah. Well, actually, menopause is an endocrine thing. Endocrine is a word that refers to things to do with hormones. So it's the entire thing to do with the menstrual cycles, its beginning, its role in childbearing, and then its end in menopause is an absolutely fascinating thing. There's a group of about 6 or so hormones that just keep going up and down throughout the month. They trigger the period, then they bring about the evolution in mid-cycle, then they bring the end of the cycle and the menstrual flow, and this goes on and on and on. Somewhere along the line, there is childbearing, and then the hormones change again. So yes, this endocrine thing it's not just in human beings. In most mammals, this process is there. And childbearing and the entire concept of childbearing, as human beings have evolved, uh, a lot has changed in their bodies, including their appearances, their size, their heights, the number of children women. So it's an entirely different topic. But yes, the menopause is an endocrine thing, and that is a medical language. In non-medical language, it's a lot to do with mostly to do with hormones and hormonal changes in women.
Thank you so much, sir. The next question is could hot flashes kill, and what could cause that?
To be honest with you, in my over 40 years of practice, no, hot flashes cannot kill. But you need to be careful, because if hot flashes are due to some other reason and they are mixed up with menopause, which is what we should not do. That is why we have to strike a balance. We know that menopause is a normal thing. Menopause will give hot flashes, it will give rise to body temperature, sweating, insomnia, all the symptoms I mentioned. But remember, a woman who is having menopause is at least beyond 40. So if she is in her 40s, it is also possible to start looking out for potentially those conditions that can give rise to rise in body temperature and hot flashes. There may be some endocrine problem, there may be some hormonal problem related to a disease. That is where the expertise of the doctors comes in, and he needs to differentiate that what the woman is facing is not just menopause, but there is an underlying disease. So an underlying disease potentially can be fatal, but hot flashes purely due to menopause, no.
All right, thank you so much. I think these are all the questions on the chat box. Well, I don't know if anyone has a question, the oral question, that is. So if you have a question, please do raise up your hand. We're going to take 3, inshallah. So please, if you have a question, please raise up your hand. Because I don't see anybody raising up their hands. Well, let me check. Okay. First person is Makinde. Makinde, please unmute your mic.
Sorry, it's Professor Makinde, please.
Sorry, Professor Makinde. Professor Makinde, if you could hear me, you're not audible. I think you have not unmuted your mic yet. Professor Makinde, if you tap on your screen, there's a mute and unmute button below your screen.
Okay. Can you hear me now?
Yeah, we can. Thank you.
All right. Now, I say a big thank you to Dr. Hassan. He has shared with us from his wealth of experience and he presented it lucidly. And he concentrated on hot flushes. Of course, there are so many dimensions to menopause. Last month, it was like an overview that we dealt with. And he has concentrated on hot flushes. And I think that's the way the foundation should go, so that we concentrate on an aspect of menopause. But Dr. Hassan has done a very excellent job. And I say congratulations, sir. But I want to say this, add this. Hot flushes might not be easy to be diagnosed in dark-skinned people. In Caucasians, yes, you will see them. You see the hue immediately from their upper chest to their faces. They could become, yes, flushed. There's a dark hue to their from the upper chest to their to up to their faces. Yes. So up to their faces. But in dark-skinned people, you might not see it because of pigmentation, melanin. So they might complain of more of internal heat, which Dr. Hassan dealt with very well. So I just want to bring that. In Black people, you might not see hot flushes because of our dark skin due to melanin. So that's one thing. Then he has said it all. You know, the first webinar, it was thriving in menopause. But I want to suggest and strongly advise that each woman that comes, there should be individualized management of each patient. Or, well, since menopause is not a disease, of each client. Let me put it that way. Yes, because all said and done, within a year from my own experience of about 45 years, the hot flushes or internal heat will subside. If you carry out many of the things Dr. Hassan has mentioned and you engage with her, she comes to you from time to time and you cancel her. All these things will vanish within a year. And I shared from my own experience that it's only a few that you have the hot flushes, internal heat going beyond 1 year, and that is it. But from time to time, there could be an individual that will need hormone replacement therapy. Like I said in my practice, I shy away as much as possible from giving hormone replacement therapy because there are controversies about it and what have you. But I've given some, and I said in 45 years, I could count on my fingers, my right hand, you know, the number of patients I gave hormonal replacement therapy to. Engaging them like Dr. Hassan has mentioned, it is, but you individualize. There may be a client that has had stressed life. Economically, she's not doing so well. Socially, she could have lost some members of her family, or her children died or something. And when she's going to menopause, she will say, and that's it. One needs to really, the mental health issues that may be associated. And that's why the management of each client should be individualized. Then, all right, I think those are the little things I just want to add. And I thank Dr. Hassan again for a very well done job. God bless you, sir.
Thank you, Prof. Thank you so much.
Thank you so much, sir, for your input. Thank you, really appreciate it. The next person is Imran. Imran has a question. Imran, if you can hear me, please unmute your mic.
Good morning. Thank you, ma'am, and thank you, Professor Makande and Doctor, for your illuminating talk, and of course to the foundation for championing such important conversations. It's really noble of you. Doctor, I wanted to ask, do you think the fact that we still haven't fully explored menopause's evolutionary purpose might have less to do with science limits and more to do with how women's health has historically been under-researched, or should I say undervalued? I mean, as a feminist, I would like your opinion on this. Thank you.
Yes, this is a very interesting question, and you know, I'm sure that some other webinar under the foundation we should discuss this also, because women's health uh, has not been given as much attention as it should be, especially when it comes to issues related to periods, menopause, childbearing, and a lot of it is taken for granted. Uh, the women play a very central role in our lives, fundamentally as mothers, as sisters, as partners, and they bring us to life. So while so much focus is there on diseases and disease prevention and disease cure, but a lot of what a woman goes through life when it comes to mental and physical health, none of that is really a disease, is a part of her being, is a part of her body. And I think, yes, I totally agree with you. There needs to be a lot more focus on this. There are people who do a lot of work on this. This foundation is doing a great work. But I think, yes, we should focus a lot more. We, when I say we, we're talking about people generally, men and women, everybody should together focus on those aspects of a woman's life that give her discomfort in the process of childbearing, in the process of having periods, in the process of having menopause. And at the end of the day, all of this is not always disease. 99% what she needs is just a lot of support, good support. So, yes, I do agree with you. More research, more work should be done on this.
Thank you so much, sir. So on behalf of the entire SAMF team, I want to extend our deepest gratitude to Dr. Shabihul Hassan for his invaluable time, his insightful presentation, and for sharing his profound expertise with us today. We would also like to extend a heartfelt thank you to all of our distinguished speakers for their wonderful contributions to today's discussion. A special appreciation goes to our partners, sponsors, and organizers. This event would not have been possible without your unwavering support and hard work behind the scenes. And finally, the biggest thank you to goes to our participants. Thank you for your excellent questions, your active engagement in the chat, and for dedicating your time to this important conversation. You are the reason we do this. Thank you once again, Dr. Hassan, for that incredibly enlightening presentation. For a concise
Thank you.
You're welcome, sir. For a concise recap of what has been said. So firstly, menopause is a natural transition, not a disease. That's the first thing I understood what was said. This was the core message. Menopause is normal. The journey is divided into four key stages: premenopause, perimenopause, menopause, and postmenopause. And symptoms are varied and perfectly normal. We had about the wide range of symptoms caused by declining estrogen levels, including mood swings, low libido, hot flashes, and so on. Then we dove into hot flashes. Dr. Hassan dedicated time to explaining what hot flashes are, why they occur, and how to manage them. Key triggers to be mindful of, including stress, caffeine, and alcohol. So in essence, this presentation armed us with knowledge and understanding, empowering us to view this phase of life with clarity, confidence, and not anxiety. Thank you so much, sir, for that. And that leads us to our main call to action. So our biggest initiative to build that community here. We are thrilled to announce that in commemoration of World Menopause Day, October 18th, 2025, in Abuja, we'll be launching the inaugural edition of Viva Menopause magazine. This landmark publication will be a vital resource featuring expert articles, personal stories, wellness tips, and advocacy. This is your invitation to be part of it. We are currently accepting article submissions with the deadline of extended to September 10th. That's we're going to stop accepting the articles on the September 10th. We are also looking for exhibitors for the launch event, sponsors and advertisers, also volunteers to join our movement. For a 10% incentive, you can help us with by securing a sponsor. How to get involved? Everything is in the chat box. Visit our website at www.vivamenopause.organization. That's org, or our email info@vivamenopause.org. All the specific links for articles, exhibitions, sponsorship, and advertising are waiting for you in the chat box right now, inshallah. Thank you to our sponsors, partners. Most importantly, thank you for your participation. A recording of this webinar will be sent shortly, inshallah. So now for our final moment together, we'd love to capture this amazing group. If you are comfortable, please turn on your video for a quick photo. This. If you're comfortable, please turn it on, so you can have a group picture.
Please turn on your video so that we can have a group picture. Okay.
Hold on, please.
I think I'm going to do it in batches because the screen is quite long. So I'm going to do it in batches. So much.
Please turn on your picture so that we can snap you guys.
All right, I'm taking the first screenshot now. 1, 2, 3. All right, I will move to the second part.
Please, Mrs. Adewale, Miss Mary Laura, please, you can on your video if you are comfortable with it so that we can have your face on our. Okay, thank you.
Our able moderator, your video is not on yet, and I'm about to take the second screenshot. All right.
Okay.
Right, 1, 3, go.
1, 2, go, please.
All right. Go to the third part. Okay, I think we don't even have a third part. I think that's it for the people that have on their
Please, thank you very much. Thank you very much. Please, if you are interested in our program, please feel free to click on the link, and you can also feel free to reach us in our through our email info@vivamenopause.org. Thank you.
Thank you very much.
We appreciate.
So yes, let's continue to collaborate and change the narrative around menopause together. From all of us at SAMF and Viva Menopause, thank you for your time and passion. Please have a wonderful day. Thank you. I don't know if
Thank you.
has anything to add. Rahma?
No. Thank you. Thank you, Hawa. Thank you, everyone. Thank you, Dr. Hassan, for joining us today.
Thank you
So
very
pleased to
much.
have you. Thank you, sir.
All right. Bye, everyone. Thank you.
Thank you very much. Thank you. Thank you.
My team is like thank you.
Thank you, the Nogas president. Thank you, everybody. Thank you, my colleagues. Thank you, all my friends. Thank you, professors. Thank you, all that have joined. We appreciate you. God bless you. Join you by the end of the month. Thank you.
Thank you, Magistrate. Wonderful. Thank you. Bye
Thank you
bye.
very much.
Thank you all. Thank you all. Thank you. This will be the end of the program. We'll see you next time.